With COVID-19 cases rising in the state of California, Florida, and Texas, it renews our questions about what to do to keep ourselves, our families, our loved ones, and our children safe. So we have asked pediatrician Dr. Tanya Altmann to come in and kind of talk to us about where we are now. Hello, good to see you.
Hi, good to see you too. Thanks for having me on.
Well, I already appreciate your expertise on this matter. So let's first talk about these increasing cases that we're seeing, particularly in California. What do you think that is due to?
So I think we're seeing increasing numbers now because people are going out more and getting exposed. At least they were a few years ago, because let's not forget there's that lag between when people catch COVID-19 and the test comes back positive. So we were doing really great with the shutdown in terms of numbers. And I think, everybody got a little stir crazy. People started laxing up. I mean, I have to admit, even I laxed up a little bit in my guidance to families because there's only so long you can keep kids indoors. But then as soon as we let people out, and especially as soon as people stopped wearing masks and distancing and hand washing, those numbers are really shooting up right now. And we are really having a huge issue. And I'm just so concerned, especially because I've been working so hard to get our kids back to school in person this fall, that I'm really hoping this doesn't derail all of those efforts.
We're going to talk about school in a second, but I want to just stay on this thread of kind of everybody getting back to normal and forgetting the basics. What does that do when case counts start to spike? What does that do to the hospital system? What does that do to the medical community? And then in turn, perhaps hurts other people seeking other kinds of medical treatment.
That's a really good point. So right now we're seeing increasing numbers in younger people, which in some ways is good because they're not hospitalized as often and the death count, is not skyrocketing like the case numbers. However, it will catch up with us. And if you look at other states like Arizona and Texas, they are running out of hospital beds. And if California continues on the same path, we will too. The other point you made, as hospitals get busier, it does affect other people that have regular illnesses. When we first started with the COVID-19, people were scared to go to the hospital, right, for heart attacks and other things, and they were avoiding emergency care. So we were saying, no, please go. It's safe. It's clean. And now we're going to be back to where, how do we have space for them all? There's only so many beds available. And so I think everybody needs to take a step back here and realize it doesn't mean you can't go outside. It doesn't mean you can do a little bit, but you can't do everything, and you have to be cautious. This is really all about public health. And it's about the importance of the role of community. We're all in this together.
Right. Let's talk about, you talk about kids a lot. Obviously, you're a pediatrician. You see a lot of children. You see a lot of concerned parents. I know a lot of parents are concerned about going back to school. I keep getting asked, do you think we're going to send our kids back to school in August? Is it safe?
So I really hope our kids can go back to school in August. And the American Academy of Pediatrics just released new guidelines where they strongly advocate that the goal of every school should be to have students physically present in school. Now, this doesn't mean send them back no matter what. It means let's try to do all these measures that we've been working on, smaller cohorts of kids, 3 feet distances between desks, masks, hand washing, disinfecting. But we've seen some of the problems that have occurred with the kids being home since March, the lost learning, the mental health issues. So really the goal should be to get kids back in school, because school is so important, not only for math and arithmetic, but also for socialization and mental health. And for many kids, that's where they get their nutrition, their exercise, and their support.
Can kids transmit COVID-19?
Yes, anyone can transmit COVID-19, but based on the data we have, it does look like kids don't transmit at the same rate that adults do. So when you look at COVID-19 in kids and teenagers, it really behaves differently than other respiratory viruses, which is a good thing. And although there's still much to learn, the evidence we have right now does indicate that kids and adolescents are less likely to be symptomatic, less likely to have severe disease, and less likely to become infected and spread the virus. And so these are things that will really also help us get those kids back to school.
Lastly, should masks be a political statement, or is it just good hygiene and health to protect yourself?
So that's a great question. And it's really unfortunate that everything is becoming so politicized. I mean, we're talking here about health. And when you look at other countries around the world, they wear masks. I've had patients under chemotherapy who wear masks. Masks are something we do to protect ourselves and everybody else around us. As a physician, I wear masks all the time. And although it can be challenging for young kids, I've been working with my 5-year-old to teach him how to properly wear a mask. I think it is very important to protect the community and show that you care about others just as much as you care about yourself.
Dr. Tanya Altmann, thank you so much for your time and your expertise. And I'm sure we will talk to you again.
Thanks for having me on, Lisa.